Hi everyone, welcome to the session of Biochemistry NEET 2025 recall. So first let us analyze the question. Difficulty level, if you ask me, it was easy to moderate. It followed the trend of NEET 2024 question pattern, and almost every topic's not direct repeat was there, but all the questions were from previous year topics only. Then if you ask me the order, like which is the most important, most frequently asked question in NEET 2025 biochemistry, I'll say metabolic disorders had around 9 questions. Then vitamins and minerals about 3 questions. Equal to that is molecular biology about 3 questions. And then the only one question from the core biochemistry. So we will see the questions one by one. The first question that I am going to discuss is a 65-year-old male patient with a fractured arm presented with a bleeding from gums. Then perifollicular hemorrhage. His diet mainly consists of tea, biscuit, buns and bread since he stays alone. Which of the following enzyme is deficient in this man? So we have to find out what is the dietary deficiency here. So definitely it is a clear cut answer is there. Bleeding from gums, perifollicular hemorrhages. It is pointing towards vitamin C. Next, we have to find out what are the enzymes that require vitamin C. Most of the hydroxylases require vitamin C. So among the hydroxylase, the two very important hydroxylase are prolyl hydroxylase and what's the next one? Yes, it is lysyl hydroxylase, right? So here this is the one which is causing a defect in collagen. Which structure of collagen? Triple helix of collagen. Okay, so the answer is clear here. So answer here is prolyl hydroxylase is the enzyme that is deficient here because of vitamin C deficiency. ALA synthase, which is the vitamin required, it is PLP, otherwise B6. Glutathione reductase, which is the vitamin required, it is B2, otherwise riboflavin. Galactosyl transferase has nothing to do with any of the vitamins. So that is how the answer came to be option A. Now we'll go to the next question. A man on long-term hydrochlorothiazide present with cerebellar ataxia, horizontal nystagmus, bilateral symmetric sensory motor peripheral neuropathy, right heart failure. No history of alcoholism. This is the word that everybody was confused. As there is no history of alcoholism, what should we write? Okay, which of the following deficiencies are associated with this? So if you see the clinical picture, you can see cerebellar ataxia, nystagmus. All these are features of what? It is features of Wernicke's encephalopathy. Wernicke's encephalopathy, we know GOAN, where we know there is nystagmus, there is ataxia, there is ophthalmoplegia and global confusion. Global confusion. All these are suggestive of a case of Wernicke's encephalopathy. What about this one, the symmetric sensory and motor neuropathy? It is dry beriberi. Dry beriberi. Now what about the right heart failure? This is the serious manifestation which is wet beriberi, where there is peripheral edema, then right heart failure and cardiomegaly. All these are features of wet beriberi. So all the features are suggestive of B1 deficiency here. Now what confused was no alcoholism, but alcoholism is not the only cause of B1 deficiency. The other causes of B1 deficiency is, the clue is given in the first sentence, long-term hydrochlorothiazide therapy. So that is another cause for B1 deficiency. Okay, so the answer here is thiamine. It is option D. Now let us go to the next question. An 18-month-old baby presented with weakness of limb, cherry red spot on macula, seizures. Mother had history of one spontaneous abortion at 4 months. Lab investigation showed deficiency in the enzyme hexosaminidase. Which of the following biochemical molecule is accumulated here? Okay, so if the question is what is the disorder, then I think most of you might have answered. But what is the compound that is accumulated? That confused you. So in NEET 2025, what I see is that rather than the question, the options confused you, right? So what is this hexosaminidase? What is the role of hexosaminidase? It is an enzyme which convert GM2 ganglioside. Hexosaminidase is the enzyme which converts GM2 ganglioside to GM3 ganglioside. So if this is deficient, then GM2 ganglioside is the one which is accumulating. Under hexosaminidase, there are two disorders. One is Tay-Sachs disease. In Tay-Sachs disease, which is the enzyme that is defective? Hexosaminidase isoform A is defective. The second one under GM2 gangliosidosis is Sandoff's disease. In Sandoff's disease, which is the hexosaminidase that is defective? It is hexosaminidase A and B. Both isoforms are defective. So that is coming under GM2 gangliosidosis. And the ganglioside that is accumulated there is GM2 ganglioside. Now, what about this GM1? Where is GM1 ganglioside accumulate? If there is a defect in an enzyme called as beta-galactosidase, then GM1 ganglioside is not converted to GM2 ganglioside. So, what is accumulating here? GM1 ganglioside accumulate, and that is called GM1 gangliosidosis. Okay, so the answer here is A, that is GM2 ganglioside. What about galactocerebroside? In which disorder galactocerebroside accumulate? It is Krabs disease. Sphingolipids is actually a vague term. So if the question is sphingophospholipid which is accumulate, we should think about sphingomyelin. So if the option is sphingomyelin, then what is the disorder where sphingomyelin accumulate? It is Niemann-Pick's disease. Okay, so we'll go to the next question. So this is a 10-year-old boy presented with subcutaneous xanthoma. Subcutaneous xanthoma is otherwise tendon xanthoma. Then father also gave similar history, died prematurely. Lab investigation showed total cholesterol is very high. Triglyceride is almost normal. LDL cholesterol is very high. Then HDL cholesterol is very less or normal also we can say. It is not markedly elevated, but LDL cholesterol is the one which is elevated here. So, which of the following types of hyperlipoproteinemia does this boy have? So, this is a case of type 2 hyperlipoproteinemia. It's clear-cut diagnosis, it's a type 2 hyperlipoproteinemia. Again, the option confused you because under type 2 itself, 2A and 2B is given. 1, it is not the answer because in 1 we know triacylglycerol is the one which is accumulating. And we know chylomicron accumulate, VLDL accumulate. Type 3 means it is ApoA deficiency. So both triacylglycerol is elevated, cholesterol is also elevated. It is a kind of both are elevated. Here exclusively cholesterol is elevated, triglyceride is almost normal. So it is type 2 hyperlipoproteinemia, no doubt. Then again 2A and 2B is given. Now what should we give as answer? 2A and 2B, the presentation is not different. It is almost the same. But we have to choose the best answer out of it. Then you have to choose the most common one out of this. The most common mutation is type 2A where LDL receptor is the mutation here. So LDL receptor mutation is the most common gene mutation, and the receptor mutation that you can see there is LDL receptor gene. So that is the answer here, type 2A. Now what about type 2B? Type 2B is due to a defect in ApoB100. So here what is mutated is the gene which is for ApoB, that is ApoB gene is mutated. It is not the commonest one. So the most common is LDL receptor followed by ApoB. Now what is next mutation that you can see? One is a PCSK9 mutation, that also you can find. PCSK9, but that is also not common. It is the third common mutation that you can see in type 2 hyperlipoproteinemia. So we can see that in type 2A and 2B is given, then we should choose the most common mutated one, not the least or the less common one. So your answer should be type 2A. That is the answer. Now, next question is, a 10-year-old girl presented with freckles on face, neck, arms, hands. So, which means they are all sun exposed areas. Sun exposed areas. So, that gives us, there is one clue is that all these lesions are in the sun exposed, means there is cutaneous photosensitivity. Then it is next sentence, it is given they are sensitive to sunlight. She also has 2 basal cell carcinoma. There is increased chance of skin cancer. Okay, next question is, what is the defect here? So when you get these 2 options, then it is straight away pointing towards xeroderma pigmentosa. Okay. So in xeroderma pigmentosa, where is the defect? It is nucleotide excision repair. What are the other disorders associated with the nucleotide excision repair? Apart from that, the second one is trichothiodystrophy, and the third one is Cockayne syndrome. Cockayne syndrome. These are the disorder. Now the next one is given as base excision repair. What is the disorder associated with it? It is MUT-YH associated polyposis. DNA mismatch repair. What is the disorder? Hereditary non-polyposis colon cancer. Then NEET. Then it is severe combined immunodeficiency. So these are, so here the answer is nucleotide excision repair, because this is a case of xeroderma pigmentosa. So we'll go to the next question. A man is stuck in a tunnel for 5 days. He is alive after 5 days without any food. Which of the following metabolic process is the primary source of energy to his brain? So to answer this question, we should know what is the in the different timelines of fasting, what is the source of metabolic fuel. So the first timeline is 4 to 16 hours without food. So in this timeline, the source of metabolic fuel here is glucose, is the fuel for brain. And who is providing glucose? It is hepatic glycogenolysis. The next is 16 to 48 hours without food. So 16 to 48 hours without food, the source or the metabolic fuel here is glucose. Who is providing this glucose? It is gluconeogenesis. Then 2 to 5 days without food, what is the source? The source of metabolic fuel is ketone bodies, because there is no source of glucose. Then the brain can depend only on ketone bodies. So for ketone bodies, what is the source? It is fatty acid oxidation, becoming acetyl coenzyme A. And the acetyl coenzyme A is the one which is diverted to ketone body synthesis. Okay, so in this case, the metabolic process which is providing as a source of energy to the brain should be ketosis, because ketone bodies is the source of metabolic fuel as it lacks glucose. Now after 5 days, it is also not exactly 5 days, approximately 5 days, what is the source? So here then comes the metabolic process that happens is muscle proteolysis. Muscle proteolysis, then it becomes either ketone, give rise to ketogenic amino acid or glucogenic amino acid. Now, this is also giving energy to the brain by ketone body, or gluconeogenesis can also happen here, but we are not considering it. See, this will not happen till ketone bodies are there. So, as long as ketone body is there, muscle proteins are preserved, muscle proteolysis will not happen. So, this ketogenic and glucogenic amino acids are not extracted from the muscle proteins. So, this will not happen unless and until ketone body level comes down. So, here in the timeline of 2 to 5 days, the source of metabolic fuel is ketone bodies, and for that the metabolic process is ketone body synthesis. So, the answer here is ketosis. So, in this question also the same thing, that is, the question is simple. Because once you have seen this word alpha L-iduronidase, I know that you have diagnosed it as a case of Hurler disease. Definitely. But what was the option? Option is to find out, the question is to find out what is being accumulated. So, we should know what is being accumulated in Hurler disease. Actually, all glycosaminoglycans are accumulated in Hurler disease, especially heparan sulfate is accumulated, dermatan sulfate is accumulated, even keratan sulfate is also accumulated. In fact, all glycosaminoglycan, if you read through the lines in Nelson, it is given almost all glycosaminoglycans like heparan sulfate, then chondroitin sulfate, all these are accumulated. Now, from these options, how can we arrive at a diagnosis? Always remember, alpha L-iduronidase is a disorder where there is mental retardation. If there is mental retardation, the most important compound that causes mental retardation is the heparan sulfate. So, what we can see is heparan sulfate accumulation is there in whichever option, that should be the answer, irrespective of what is the next glycosaminoglycan present. So, from these options, we can see that heparan sulfate is present in the first option. So, that is the answer, along with the dermatan sulfate. I told you, any glycosaminoglycan, dermatan sulfate, keratan sulfate, chondroitin sulfate, all these glycosaminoglycans can be accumulated. But your answer should be something where heparan sulfate is there. So, that is the answer. Now, in this question, because there is delayed developmental milestones are there. If in this question there is a word that there is no mental retardation, then it is pointing towards She's disease, right? She's disease. So, if a word no mental retardation is given, then it is pointing to She's disease. Then if the same question is asked, what is accumulated? You should choose an option where there is no heparan sulfate. Because whenever there is heparan sulfate accumulation, there is mental retardation, delayed milestones and all. If She's disease, there is no mental retardation. Why there is no mental retardation? Even if the enzyme that is defective is alpha L-iduronidase, it is a partial defect. It's a partial defect, and because of this partial defect, only dermatan sulfate is accumulated, heparan sulfate is normal there. So, that is why there is no mental retardation. So, in the question as delayed developmental milestones is given, and because of this should be a case of Hurler disease. As there is delayed milestones and there is mental retardation, so you should choose the answer as any option where there is heparan sulfate. So, the answer here is option A. A 10-year-old child presented with enlarged orange colored tonsil. Yes, when you hear that option itself or that word itself, you have made a diagnosis. Yes, so that is orange tonsils in Tangier's disease. Then the other is there is a death in the family due to cardiovascular disease. Total cholesterol is low, triglyceride is increased, HDL is low. So, when HDL is low, total cholesterol is low. Here it is Tangier's disease. Tangier's disease is due to a defect in ABCA1 Why do we need ABCA1? ABCA1 is required for HDL, spherical HDL formation. We have seen it is a transporter of cholesterol. Transporter of cholesterol. So that is defective here. So because of this, there is decreased HDL and there is decreased cholesterol. So that is it. It's a case of Tanger's disease. Next, a baby presented with a low phenylalanine level, apparent tyrosine deficiency was seen, but phenylalanine hydroxylase level normal. The deficiency of which of the following coenzyme can lead to this manifestation? Similar question came in NEET 2024 in a different way. So what is this phenylketonuria? This is a case of phenylketonuria. This is not classic phenylketonuria. It is non-classic phenylketonuria. That is point number 1. Non-classic. So in classic phenylketonuria, what is defective? Phenylalanine hydroxylase. But here it is given, it is normal. So it is a case of non-classic phenylketonuria. Non-classic phenylketonuria is due to 2 reasons. Either a decreased regeneration of BH4 or decreased synthesis of BH4. Whatever is it, whether BH4 is not regenerated or if it is not generated or synthesized, which is the coenzyme that is defective here? Tetrahydrobiopterin is the coenzyme that is defective here. So the answer here is tetrahydrobiopterin. So in the option it is given as biopterin. So you can choose that as the answer, biopterin. Next, a frame shift mutation is introduced in a coding region at the 4th nucleotide of a 900 nucleotide mRNA. What will be the most likely outcome? So we will see a 900 nucleotide length mRNA. It will be difficult for me to draw the 900 nucleotide length. So I have just shown here some alphabets. Each of this alphabet is each codon. So these are all codons like that. There are 900 nucleotide. So if 900 is in the coding region, then that will code for 900 divided by 3. So it will code for about 300 amino acid protein, right? 300 amino acid containing protein. So here what we can see is a mutation is introduced at the 4th nucleotide. So again it is given that it is a frame shift mutation. It is not a base substitution, which means that frame shift always means either an insertion or a deletion. It is not mentioned whether it is insertion or deletion. As the word introduced is there, I am taking it as an insertion. So it means that a nucleotide is introduced at the 4th position. So I am just taking that nucleotide as an X, and this X is introduced at the 4th position. So an X is a new nucleotide is introduced at the 4th position. Now if the reading frame is when the during translation process, if the reading frame is started from the one end, what will happen? It will read the first ABC. That will give rise to a normal usual whatever amino acid is there. It will give rise to a usual what we expected amino acid only. Now further what happens? This X is introduced here. So it will be reading always in 3 consecutive nucleotides. So first 3 consecutive, first 3, next 3, like that it is going. So it start from here. So it is read like XDE instead of DEF. Again from F it start. What we expect is we read it as GHI, but it is read as EFH. So from there onwards, so from first will be normal amino acid, the expected amino acid. From there onwards, whichever amino acid is introduced, they are all not the usually expected amino acid, which means the entire reading frame is garbled from the second amino acid onwards. So what will happen? The primary structure What do you mean by primary structure? The sequence of amino acid in a protein is called as a primary structure. The primary structure of the protein is altered. So when the primary structure is altered, what is altered? The biological activity of the protein is lost. So what is the answer? No biological change. It's not the answer. Complete loss of protein function. Yes, that is the answer. It is not a partial, because from the second amino acid onwards there is a change happening. No change in the function due to post-translational. No, it is not possible. So there is a complete loss of protein function in frame shift mutation. Next question is: a patient presented with anemia, ataxia, neuropathy, positive Romberg sign. Lab investigation revealed elevated total homocysteine level and methylmalonic acid. Production of which of the following amino acid could be affected? So you have to think multiple options here. So first and foremost, what is given as there is anemia, ataxia, neuropathy, positive Romberg sign. These are all directing it towards a vitamin deficiency. Which vitamin deficiency? B12 deficiency. Yes, and investigation is showing elevated homocysteine. So if there is a B12 deficiency, what all things will happen? That is what is given here. B12 is required for the conversion of homocysteine to methionine, that we know. So if there is a B12 deficiency, what will happen? Homocysteine accumulates. So that is given here. Second, what is given? Methylmalonic acid accumulate. We know B12 is required for the conversion of methylmalonyl coenzyme A to succinyl coenzyme A. Hence, methylmalonic acid is also accumulating here. So, two things accumulate. The production of which of the following amino acid is affected? Again, the question is confusing. Which amino acid is affected? So, for that you have to go to this, where you can see if there is a B12 deficiency, homocysteine to methionine conversion is affected, right? So which amino acid synthesis is affected? It is methionine. Now what about cysteine? When cysteine is affected, if it is a deficiency in cystathionein beta synthase, which is causing a classic homocysteinuria, then which amino acid synthesis is affected? It is a cysteine. But now this is B12 deficiency. It's a case of non-classic homocysteinuria or B12 deficiency. So there methionine synthesis is affected. So the answer here is C. An 8-year-old child presented with follicular hyperkeratotic plaques over the elbow, knees and buttocks. She has dry skin, lusterless hair. Which of the following is the next step in evaluation? So what you can see here is taut skin, otherwise phrinoderma. Okay, so in a case of phrinoderma, what you have to next examine is the ocular examination, because in vitamin A, so most common cause here is this is a vitamin A deficiency is the one which is causing follicular hyperkeratosis, and there we have to examine the ocular. So the ocular examination is the answer here. So this is a case of vitamin A deficiency. An unusually tall 14-year-old boy with extremely long limbs came to ophthalmologist with complaints of decreased vision. Then on examination, subluxation of lens, ectopia lentis, which of the following defect is found? So what is the protein that is defective here? Or which is the gene that is defective here, which lead to a protein deficiency? So this answer here is fibrillin 1. So remember, all these features are of a Marfan syndrome. So in Marfan syndrome, the protein that is defective is fibrillin. Fibrillin is the protein which is coded by fibrillin 1 gene. So the answer here is fibrillin. Now what about Col5A2? It give rise to Ehlers-Danlos, classical Ehlers-Danlos. You can find if there is Col5A2, that is the collagen, type 5 collagen is affected there. LDL receptor gene, if it is affecting, it causes type 2 hyperlipoproteinemia. What about this PLOD1 gene? PLOD1 gene is a gene that code for prolyl hydroxylase. Prolyl hydroxylase. and collagen will be affected here. So the answer here is fibrillin 1 gene. The next question is a 6-month-old infant presented with recurrent infection, failure to thrive. Lab investigation revealed decreased B cells and T cells and deficiency of adenosine deaminase. So definitely both B cells and T cell means it is a severe combined immunodeficiency. So the answer is severe combined immunodeficiency. The next is a repeat question. Which of the following, but not a NEET question, it was an INI question. So which of the following is used for syndromic diagnosis of infected cases like meningitis? So that answer is multiplex PCR. What is multiplex PCR? And this approach is called a syndromic approach. It is because in disorders like pneumonia, meningitis, etc., we have to start the treatment as early as possible. If we wait for culture and sensitivity, it takes about 3 days. So before that, if we want to start the antibiotic, one molecular biology technique that we can use where we'll get the result very fast. Within 1 or 2 hours, we'll get the result. That is multiplex PCR. In multiplex PCR, what we are doing is multiple random primers are used. So you can see that in the PCR mixture, multiple random primers of various organisms which cause meningitis is added to the sample of the patient's blood. So in the patient sample, we are adding multiple random primers. So if any of the random primers meet its complementary base, then it goes and binds, it anneals with that target DNA and it gets amplified, right? Now, when we look at the amplicon, we can find out which bacteria is the one which is amplified. So, based on that, we can start a treatment very early before the culture and sensitivity reports we'll get a report of this multiplex PCR. So that's about the recall session of biochemistry in NEET 2025. Before concluding, one word to you: success is not happening in a single day. It is a cumulative effect of tiny hard works that you do day in and day out. All the best for you. Thank you.